everyone. For my topic discussion today, I wanted to discuss opioids in the medical setting. For anyone that doesn't know, opioids are painkillers commonly found to be prescribed by doctors to their patients to treat persistent and severe pain. There are several medically prescribed opioids, but the most common types prescribed are fentanyl, oxycodone, hydrocodone, codeine, and morphine. The way opioids work are that they act on the nervous system to relieve pain, but are actually found to be highly addictive. Due to the fact that they are stronger than normal over-the-counter painkillers, they can cause a chemically induced euphoric effect on the brain. One cause for opioid addiction is that they have either been prescribed in high dosages or have been prescribed over a long period of time, something not recommended by doctors. According to the Institute of National Drug Abuse, in the 1990s, when opioids were first introduced, pharmaceutical companies had assured the medical community that patients would not become addicted to their prescription opioid pain relievers. Thus, healthcare providers began prescribing them at greater rates. This was the beginning of what would be known to be the opioid addiction overdose epidemic in the US. Something I questioned from within my findings was, doctors know that opioids are highly addictive drugs. Why do they continue to prescribe opioids to their patients over an extended period of time or at high rates? Is there a way that opioid usage can be prescribed or monitored? In the film Escape Fire, it was the Army veterans with physical disabilities that were portrayed to be the target population to the opioid industry. Many of them relied heavily on opioids to numb their war-inflicted pains and getting through their day-to-day lives. I knew a friend that told me of their uncle, a heavy smoker, that had knee surgery replacement and had become so addicted to the drug that they stopped and became morphine addicts. His nicotine addiction essentially just turned it into an opioid addiction, which was just as bad, maybe even worse. According to the NIH, roughly 21 to 29% of patients prescribed opioids for chronic pain will have misused them, and of these patients, 80% will have tried heroin. To think that such a high number of people to misuse an opioid would turn to heroin is shocking. But to learn that heroin is made of morphine is even more eye-opening. Although opioid pain relievers are generally safe, even when taken for a short period of time or as prescribed by a doctor, can lead to the dependency, misuse, addiction, overdose, incidents, and even death. It is said that the body can become so accustomed to the drug it will believe it is necessary for survival. Every day, more than 90 Americans die of an opioid overdose. This is how strong the drug effect is on the nervous system. The cost of opioid addiction and overdose in the United States was $78 billion as of 2013, and of that cost, only 3.6%, about $2 billion, is used for treatment. The cost of preventing opioid misuse and addiction is more cost-effective than its prescription. With this in mind, there are many innovations in monitoring the prescription opioids to ensure low dosages and less time for dependency of the drug. The longer a patient uses the drug, the more tolerance they build to the drug. New technology that can has helped with the opioid epidemic is health information technology. Health information technology is being used in a number of ways, such as helping to prevent medical errors, including adverse drug events, reducing the cost of healthcare through providing more targeted and effective care deliveries, helping patients manage their chronic illnesses, and measuring provider facility performances. Health IT can provide access and real-time information to support clinical decision-making, promote evidence-based care, organize and streamline referral processes, facilitate the order entry process, and to consolidate patient information into one easily accessible, accurate, and up-to-date source. Health IT is used to track patient health records known as EHRs, electronic health records, that contain information such as patient's medical history, diagnosis, medication, immunization dates, allergies, radiology images, and lab and test results. EHR include prescription drug monitoring programs that healthcare providers and pharmacists are both able to ensure medications are properly administered, and electronic prescribing of controlled substances, EPCs, to prevent healthcare providers from overprescribing. It is EHRs that are helping control the opioid abuse epidemic by helping healthcare providers share information about prescribed substances in an easier way. This information is transferred between doctors to patients to pharmacists and to better understand what prescriptions have been prescribed and how to monitor whether they are being used correctly and in a timely manner. Although the benefits of EHRs outweigh the costs of the opioid epidemic, many hospitals or clinics still do not have access to the problem because of the cost of HIT. Fewer than 1 out of 10 hospitals have EHRs. Most practices need to spend about $65,000 to $100,000 to install the entire EHR system. For a hospital, it costs at least $2 million and can be much more than this. Much more than this for a large academic medical system. Acquiring the technology is based on several factors such as patient volume and whether administrative efficiencies that can be achieved with HIT or whether healthcare services are actually improved by the added technologies. If these factors can be overlooked and carefully managed by a simple transition into the system between small practices and large independent departments in a hospital, the opioid addiction epidemic would have a significant decrease in mortality rates with better management and prescription medications. I believe that with the use of this, hospitals will come around to adopting this technology as it benefits healthcare in one way more than another.